So this is in response to a segment of a bigger comment that I had discussion with this individual. Here's what I gotta say. You're right to some extent, in a sense that not for everybody pain and suffering tends to go away after transition. In working with adults, I have seen cases where it didn't go away. I have spoken about people who have detransitioned because the pain got so much worse because of society, because of lack of support, because lack of acceptance. But by far, for adults who do decide to gender transition, the pain and suffering either gets dramatically less or tends to go away altogether. And I would love for people to just accept themselves as they are, but for generations to know that that's not an option, because for years, people tried to do that. I have adults who tried to accept who they are for 40, 50, 60 years of their life, and they're still struggling with gender dysphoria. So I just don't know how many more years we can give people pain and suffering and use this idea that they just need to accept themselves as who they are. Here's another thing behind this rationale, this concept that sometimes people say is that gender transition is not a viable option because pain and suffering always going to be there. If that were actually true, we would see way less people going through gender transition. Why? Because we would have so many people speaking up and talking about how much they're still suffering and they're still in so much pain even after transition. Instead, we're seeing the opposite. We're seeing adults coming up and saying that by far they feel better, by far they feel much more in touch with themselves, by far they feel much more congruent with themselves. So I just think that perpetuating the idea that it never goes away, there's still pain and suffering, that's not true. The reality of life is that there's pain and suffering with everything, but to say that gender dysphoria doesn't take away a lot of it in relationship to dysphoria is just really, really not true.